Hi, welcome to my digital story on the future of laparoscopic surgery. Let's begin. First, I started off listening to a podcast, Legends of Surgeries, episode 58, The Story of the Appendix. Did you know that the risk of appendicitis is the most common acute surgery? It's actually 8.6% of males at risk and 6.7% of women. Not many people know what the appendix function really is. Well, the purpose is it's in our immune system. It is the bacterial safe house of our flora. It's a helpful bacteria that help for digestion. Fun fact, did you know that monkey, cats, and dogs do not have appendixes? Second, I watched a TED Talk by Nikolai Begg, a tool to fix one of the most dangerous moments in surgery. Nikolai Begg explained his first time in surgery, just another day at the office, but to save lives. Appendectomy surgery is one of the most common routine surgeries performed in a hospital nowadays. Normally, this is done with a large incision in the lower right abdominal wall. Now, there is no more need for those large open incision surgeries. That is a thing of the past. Today we like to do laparoscopic surgeries by creating 3 small holes and inserting trocars and cameras and all the instruments to perform the surgery. This is a great new technique, since this means less risk of infection and less time for recovery. Trocars puncture the skin, but you do not want to plunge too far into your organs and blood vessels. That could cause a big problem. A great example Nikolai Begg used for maybe people who don't see trocars on a daily basis or know what they are. That example is a Capri Sun. When you stick that straw in, you are anxious to know if you're going to plunge all the way through to the bottom and juice goes everywhere. Or are you going to get that perfect plunge where you get to enjoy that cold, nice beverage on that hot day? But I thought laparoscopic surgery with trocars was supposed to be safer, minimally invasive. Where are all these complications coming from? Well, the FDA in 2003 said trocar insertions was probably the most dangerous step in a minimally invasive surgery. In 2009, trocars caused of 50% major complications during this case. Nikolai Begg, he created a new device to keep laparoscopic surgery minimally invasive and safe during every step. Created a device that once the trocar punches through the tissue, the sharp tip retracts back inside of the trocar. This happens within 4/100th of a second. Brilliant! I mean, I wish I would have thought of this idea. A quote by H.C. Jacovius: "It is puncture itself that causes risk." This was the first person to ever do laparoscopic surgery in 1912. This problem has been going on for over 100 years. I believe the safety of our patients is always our number one goal. We are there to save lives of these patients. This topic holds dear to my heart, since I have witnessed this in my career every day. This is not because a surgeon does not know how to do his or her job. The puncture process of a trocar is always a guessing game. I really hope Nikolai Begg's trocar would stop that guessing game and guarantee a safer surgery. I hope to see a presentation coming soon to my job on the new trocars coming into practice, so we can start having safer surgeries every day. Just like Nikolai Begg says, puncture is everywhere. You never know when you will be that person on the table. So I believe this topic is so important because the main goal in all healthcare field is to keep every patient safe. Me, for you, and all of your family members. Thank you for your time, and I appreciate you listening to my digital story on the future of laparoscopic surgery. Have a great day, everyone. One quick thank you to my amazing references that made this digital story possible.